A cloth face covering or a mask is recommended by the Centers for Disease Control and Prevention as a simple barrier to help prevent the spread of COVID-19.
Is you going to adjust the nose like this?
There are various types of face coverings that people are encouraged to wear to prevent the spread of COVID-19. UCSF Fresno's Kenny Bond is an emergency medicine physician at Community Regional. He stresses cloth face coverings or mask greatly reduces the spread of COVID-19 transmission.
Up to 80 to 90% depending on the type of mask. I don't want to get too caught up in the mask, but I think wearing them is really important to protect not just yourself but others around you.
Dr. Bond says those who don't show symptoms are referred to as asymptomatic and can still spread the coronavirus. People who are medically vulnerable, like the elderly, young children, or people with pre-existing health conditions, are at greater risk.
Some people are talking about whether they need it or if they're young and healthy, but understand that a lot of people may be asymptomatic, so you may actually be infected and you may not feel anything.
Any mask is better than none at all. Dr. Bond says these masks are for one-time use.
You can wear them once, they just go through a lot, so most people are doing what we call extended use, which means basically once you can use them until you see them get dirtied, tarnished, holes, break down. Once you start seeing them break down, toss them.
He encourages people to wear handmade ones or cloth face coverings. Just wash them daily.
I'll tell you what the bandana is great for. It's great for kids. Because wear it as a bandana and then they can bring it down when they need it. So my kids use this all the time because it's much more easier to comply with children.
If you wear glasses, you can still comfortably wear a mask and prevent fogging up your lenses.
Easy fix. Make sure that you have a seal across the top. Almost all the fog is coming up because you're breathing and it's shooting up. If you have enough space on the bottom and you're sealed across the top, it'll prevent the fogging.
So far, COVID-19 is most commonly spread through respiratory droplets produced when an infected person coughs, sneezes, or talks. Dr. Bond says that's why it's crucial when wearing a face covering to wear it correctly.
Make sure your nose and your mouth are covered. I see a lot of people because of the heat walking around like this because they feel like they're having trouble breathing. I know it can be uncomfortable, but it's important to keep this covered.
Dr. Bond hopes these tips help and everyone complies with recommendations to wear a mask, not only for the health of themselves, but for others.
It's up to the public, and that's why the outbreak's really coming up.
The CDC does authorize some to not wear a cloth face covering. Those include children younger than 2 years old, anyone who has medical trouble breathing, anyone who is unconscious or incapacitated, and anyone who is unable to remove the cloth face covering without assistance, though all should still practice social distancing and good hand hygiene.